A pleasant day to you all. My name is Dr. Dickerson from Fayetteville Plastic Surgery and Cape Fear Aesthetics MedSpa in Fayetteville, North Carolina. We put a nice little video together to once again answer a lot of the questions that our clients have either over the phone, doing their initial research, so hopefully this will help them out as far as going from consult all the way through treatment. So let's get started. So one of the first questions that we always have is who is a candidate for the ThermiVa? And it's for those individuals that talk about having an overall loss of vitality, or what we call the loose vagina. For those individuals who are perimenopausal, there's also concerns about a dry vagina, lack of lubrication, and unfortunately increased pain during intercourse. Those who have a leaky bladder, and it's for those individuals who just want to stay dry with their normal workout, even after a cough or a sneeze, once again, to improve their wellness as far as that issue. And there are some individuals who are starting to have a little bit of a falling bladder or rectum, and that could be just normally from after vaginal deliveries. As well as there's a significant amount of clients that my wife and I attend to who's a gynecologist who has some concerns about their orgasmic wellness as well as function. So first and foremost, let's talk about the safety of ThermiVa. I have here actually in my hand the actual wand, as we call it, and this is actually a single-use applicator. So we open this in front of the client. Once it's actually removed, there's actually a little safety device. I don't know if you can see, there's a little red dot that doesn't allow us to actually reuse this. So once again, single use, no problems with any cross-contamination. Also, this is specifically designed ergonomically for the client as well as the provider. It is temperature controlled, and what we mean by that is there's a set temperature, so it doesn't allow us the temperature to get too high. There's been no reported burns in our practice with the use, and once again, it's a very comfortable treatment. Most of our clients talk about it as just more of a hot stone massage, if you will. So this is actually a blown up picture. Once again, just the size of an index finger, very smooth, very contoured. And this is actually the active site of the probe, so it allows us to once again treat the tissue to provide contraction as well as improve collagen stimulation. So why all of a sudden the demand for the ThermiVa? One of the biggest things that we have, especially with our clients, is they have very busy lives, professionally as well as personally. This allows us to actually treat the vulva for a more rejuvenating appearing vulva, as well as to be able to do it non-surgically. So what does that mean to the client? There is no pain. There is no anesthesia needed. The procedures are actually done in about a 30-minute, 35-minute treatment, and once again, there is no downtime. And what that means is they can be ready for use that evening with their spouse. So that's actually fantastic as far as all those neat items. So how does it work? There's going to be some heating, and then we're going to get an immediate contraction. But once again, a hot stone massage. It is not a painful, it's not an irritation. And most of our clients talk about this feeling of a waking up sensation, if you will. There's going to get some immediate remodeling, which we're going to show you in some of the before and after pictures. And then there's going to be a continuing, ongoing turning over for rejuvenation of the internal and external labia. The biggest thing that I have noticed in my practice is the advantages of the ThermiVa over the other treatments, and they include no pain. Once again, we're able to treat the entire vaginal area outside as well as inside. The treatment will actually last for about a year. So what that means is some individuals will even consider touch-ups in a year, 18 months, and some don't need any at all. And this is, of course, actually for all ages. So for even the individual who is post-pregnancy, one of the biggest questions I have is, when can I do this after pregnancy? And we usually wait about 6 to 8 weeks. So let's just go over the anatomy just to make sure that we have everything clear. This is the mons pubis. This is the clitoral area. This is what we call the labia minora as well as the majora. Now, for those individuals who have an excessive amount of skin in either of these areas, sometimes a labioplasty would be the better treatment for them. This is, of course, is the vaginal opening and the perineal body. So all of this we want to tighten up outside as well as inside. Now, we use this also in our consultation to educate our clients. the clitoral area is not just the hood. There are actually these arms as well as these saddlebags, and this whole area encompasses about 8,000 nerves or greater. So once again, by using the radio frequency to upregulate the sensitivity of this area, this allows us, for some of our clients who were not reaching the orgasm, to reach orgasm, or for those who were taking a longer time, to actually shorten that time, once again improving their overall wellness with them and their partner. This is once again a normal view. We want to improve the outside laxity here, as well as improve the overall health of the vaginal wall. So some of those skin changes, skin tags, atrophy that we're seeing, those will improve as well. And overall, there's a newer coating, a realignment of the inside of the cells for our client. And we can see some immediate changes. So this is a picture was provided to us by Dr. Alan Saad, where we can see actually an improvement of the external vulva as well as the internal. And this is once again immediately after treatment, and this continues to improve. This is actually a 3-month time span of before, through treatments, as well as post-operatively several months afterwards. So we can see the continued ongoing of the tightening. So this client not only says that they had an improvement outside, but they also once again have testimonials of improvement for inside. And this is what we think that's actually happening on the inside. It's a physiology we call thermoneogenesis. This particular picture is the normal lining of the lumen, and what's happening is we feel that the radio frequency is causing a stimulation of these nerves of the vaginal wall to release what we call neuropeptides. This allows the arteries to actually expand and increase the amount of lubrication that's produced inside of the vagina. So especially for those perimenopausal women, those individuals who essentially have a problem with dryness and atrophy, this is very significant in improving their overall quality. And let's look at some of the study results. So we used in the initial study 2 different scales. One is the sexual satisfaction and one is the vaginal laxity scale. And we noticed that there was a 2-point improvement with the sexual satisfaction scale. So for those individuals, let's say were at a 1 when they first started, at 2.5 points or somewhere between fair and good. Those who were at a poor, once again, a 2.5-point improvement, which was statistically significant. And for the vaginal laxity scale, fantastic improvement as far as the overall improvement there. So for the individual who is a 1 is now a 6. Those who are essentially a 2 are now a 7. And in those results, the clients reported improvement moisture production. They were drier, less leaking, with stress incontinence, working out. They also said that there was a significant improvement of their orgasmic wellness. All of them would recommend it, and all of them were, of course, happy with their results. To prep for the procedure, those individuals we'd like to shave for their before and after pictures. We want them not to be on their menses, no active lesions. You can drive to and from the appointment because, once again, no anesthesia, no pain, and it can be done the same day as the consult, and we'll, of course, take standard before and after pictures. Well, hopefully this answered a lot of the questions about ThermiVa. This is Dr. Edward Dickerson at Fayetteville Plastic Surgery. We hope to see you soon. There you go.
So I guess I need it.
When you're confident, you're beautiful.